Medicaid is a joint federal and state health insurance program for people with low incomes, families, pregnant women, seniors, and individuals with disabilities. It covers doctor visits, hospital stays, prescription drugs, preventive care, and long-term services such as nursing facility care. Around 83 million Americans rely on Medicaid for essential health services. Proposed scale of cuts. Legislative proposals aim to reduce federal Medicaid spending by at least $700 billion over the next 10 years. The goal of these cuts is to offset tax cut extensions and reduce the federal budget deficit. Independent estimates project that such reductions would lead to millions more Americans losing their health coverage. Mechanisms of the cuts. Work requirements. Adults between ages 19 and 64 would have to work, attend school, volunteer, or meet other exemptions for 80 hours each month. Meeting these rules would become a condition for maintaining Medicaid eligibility. Reduced federal matching. States that expanded Medicaid under the Affordable Care Act could see a lower federal matching rate. This would shift more costs onto state budgets and might prompt states to roll back expansion or tighten eligibility. Caps on provider taxes. States use taxes on hospitals and other providers to draw down additional federal dollars. Limiting these taxes would reduce the revenue available to support Medicaid providers. Coverage loss estimates. Independent analyses suggest that cutting Medicaid funding on this scale could result in 8 to 12 million more uninsured people by 2034. In deeper cut scenarios, up to 20 million could lose coverage. The exact number depends on how individual states respond to reduced federal support. Who will be affected? Children and families. Medicaid covers roughly 40% of all children in the United States. Reducing eligibility thresholds or imposing new paperwork requirements would risk pulling coverage away from many low-income families, jeopardizing preventive care and routine immunizations. People with disabilities and seniors. Medicaid finances the vast majority of long-term care services for seniors and people with disabilities. Cuts would threaten access to in-home care, assisted living, and nursing facility services that most families cannot afford privately. Working-age adults. Many adults in low-wage jobs depend on Medicaid because they have no employer-sponsored insurance. New work rules and funding reductions could push these workers into uninsurance or leave them unable to afford treatments for chronic conditions. Impact on healthcare providers. Rural hospitals. These facilities often operate with thin financial margins and rely heavily on Medicaid payments. Reduced funding could force closures or reduce services, leaving rural communities